Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi students, our topic today will be on antiviral drugs 2, part 3. In this lecture, we will continue our lecture on antiretroviral drugs. We will look at the antiretroviral therapy or ART. Before we proceed, let us revise again what are the goals of antiretroviral treatment. First, we want to improve the quality of life and prolong the life of our patients. Then, to reduce HIV-related morbidity and mortality. To achieve reduction in viral load, to restore and preserve the immune function, to minimize side effects of drugs, and finally, to reduce HIV transmission. So what is ART? Antiretroviral therapy, or ART, is the use of a combination of 3 or more antiretroviral drugs to achieve viral suppression. It is a lifelong treatment and it is also known as combination ART or highly active ART or HAART. So please remember, for ART, the minimum number of drugs is 3. Before we start the treatment, we first have to assess the patient according to the WHO HIV staging, and second, to measure the CD4 count of the patient. This is the WHO's clinical staging of HIV and AIDS. There are 4 stages altogether, ranging from asymptomatic to immunodeficiency states, and that you can read in details in my lecture notes. So when to start ART? These are the guides when to start ART according to the age of the patients. For adults and more than 10-year-old patients, we have to start ART if the CD4 cell count is 500 cells over millimeter cubic or less, and patient with stage 3 to 4 WHO staging with CD4 cell count less than 350 cells per millimeter cubic. And there are also some conditions that we have to start ART regardless of the CD4 cell count and WHO staging, which include HIV positive patient with active TB, HIV positive together with hepatitis B co-infect with chronic liver disease, and in pregnant or breastfeeding women with HIV. In patients between 5 to 10 years old, we also have to start ART when the CD4 cell count is 500 cells per millimeter cubic or less, and patients with stage 3 to 4 WHO staging with CD4 cell count less than 350 cells per millimeter cubic. The condition that we have to start ART regardless of their CD4 cell count are in patients with WHO staging of 3 to 4 and HIV with active TB. For children from 1 to 5-year-old and in infant, which is less than 1-year-old babies, usually ART is initiated regardless of WHO clinical stage and CD4 cell count. So what are the combination of drugs in ART? These are the preferred and alternative combinations of the first-line ART drugs. For all of you, it is important to know and memorize the preferred first-line regimens, which are tenofovir plus lamivudine or emtricitabine plus efavirenz. If you can remember this, I will be more than happy. Almost every drug comes with side effects. What are the side effects of antiretroviral drugs? These are the side effects of NRTIs. Please remember some of the important and specific side effects of each drug. For example, zidovudine may cause macrocytic and neutropenia. Stavudine and didanosine may cause peripheral neuropathy and pancreatitis. Lamivudine may cause nausea, headache, and fatigue. And tenofovir may cause Fanconi syndrome. For NNRTI and protease inhibitors, these are the side effects. And these are the side effects of integrase inhibitors and fusion or entry inhibitors. You can read in my lecture notes in detail later. Okay, that's all for the antiretroviral agents. Hope you can understand more after watching the videos. If you have any questions, you can text me at any time or you can ask me during the online Q&A session later. Good luck and happy learning. Pray hard, study smart. See you in the next topic. Assalamualaikum. Bye-bye.